Sorry for that. So I was saying that you are the Chief Operating Officer at Norway Health Tech. You were also the founding CEO of the Health Cluster, Norwegian Smart Care Cluster, that was established in 2014, and that has been merged now with Norway Health Tech earlier last year in 2025. And so today you will share with us your extensive experience in both operation of clusters, management, and financial aspects. So we're really delighted to have you, and I will leave you the floor now.
Thank you, Maureen, and thanks for inviting me to tell a little bit about Norway Health Tech and the everlasting struggle of getting financing into a cluster. And please stop me at any time. Let's make this an interactive session. I think I would like to start just by telling you who we are and what we do. And there are 3 health clusters in Norway. You already know Oslo Cancer Cluster with Maureen, focusing on cancer oncology. We have a life science cluster focusing on life science and biotech in a broader sense, not just health, but also aqua and marine. And we, as in Norway Health Tech, we are, I would say, digital health and med tech. So we work in a threefold mission that we want our members to create better solutions for the patients. We want to make our health system more effective, and we also want to help build a Norwegian health industry. So the 3 main strategic pillars that we work on is: how do we accelerate growth in health tech companies? How do we contribute to get sustainable and efficient healthcare services? And then we are a big public-private network for health innovation, and we need to continue to develop that in the best possible manner. We are a fairly large team for a cluster. So we are, as you see, we have different kind of skill levels, and we are all fairly seasoned cluster workers. I have been there for 12 years in the joint clusters, and we have several people who have been with us for a long time. So the makeup of our cluster and how we define the cluster is that we have the whole value chain of digital and medtech into the cluster. So we have 230 plus companies, 120 municipalities, 18 health authorities, that's the hospitals and hospital regions. We have universities, college and research institutes, patients and user organizations, investors, and then of course the collaboration with a lot of other clusters and innovation networks into this, as well as the public, the people from the type of ministries and the government side of things in this. So we are a complete ecosystem for this. And just as a brief point, showing you what the companies deliver is the whole range of preventive public health, diagnostics, treatment, logistics, journal and support system and service providers. So we are a national cluster in Norway, but we also have a regional footprint, meaning that we have set to make a structure for building the sort of the national team in Norway. And to illustrate, Norway is it's a fairly large country geographically. We are not many. We are 5.5 million people, but the distances in Norway are huge. So if we on the map flip Norway on the side, it covers the ground all the way to Rome. So Norway is a fairly large country, and meaning also we need to have hubs and things around the country. So our main office is in Oslo, the capital, And then I'm in the Stavanger office that is on the very west. And we have another office in Bergen. And then we have partners all over Norway. So we have really a regional structure into this. We are Norway Health Tech. So what do we offer our members? And I'm sure this is the same as a lot of you guys are doing in your clusters. But for Norway, since health is a public issue, 90+% of all spending on health in Norway is public. So we are a big public-private collaboration. We do a lot of knowledge building through courses competence. We work on internationalization and export. How can we help our companies? And as of today, we are focused on the Nordic countries, UK and Germany. And then this is dependent on where our members say they want to go and how we can align there. We have testing and validation facilities and skills in the cluster. We work a lot of grants and private capital for our members. We advise them. As you know, Marine is an EU advisor in Oslo Cancer Cluster. We have a peer in Norway Health Tech that works together with Marine. So this is also a very important part of us. And then we have a member benefits program where the suppliers in the cluster who has more general type services offer their services to other members on a favorable terms. So the key things in a cluster, I said, network, funding, internationalization, testing insights, but also then public advocacy. And with public advocacy, it means that we try to be a voice into the government to better the frame conditions for both companies and the service itself and in how to do business in Norway. So just some numbers on network and collaborations. In 25, 77% of all our members participate in events, so that is really great. We had 113 events organized, of which 83 physical, 27 digital, 3,390 participants, resource group, and 491 is our Health Tech Festival, our annual physical meeting in Oslo that also now comes up on June 11. A bit on the private funding and capital side, 6 members receive support from EU. We are very pleased with that. The numbers doesn't look big, but we are a small country, and you know the needle and the haystack to get into EU is big. So that's a great stuff. And we have 106 members are engaged in one-to-one EU discussion. So that is something we are proud of. On internationalization, we just some random numbers. We have had 38 activities for international market entry, 70 companies through our resource groups in this, 22 market entry programs, and yeah, so this is a key element of our offering to our members. And then test and validation, which we see is a very important side, is that for our companies to be exposed to the service, whether it's in the municipality or in the hospital, it's very important for them to develop the right products and software and technology into this. So we have over many years developed Norwegian Smart Care Lab, now called Norway Health Tech Lab, as a vehicle and knowledge base to help companies. Yeah, insight and competence. This is, of course, we put up a lot of knowledge work and public advocacy, as I said, to drive place. And I will not say meeting places. We have various meeting places. Our biggest one coming up on June 11th, the Health Tech Festival. So if any of you plan to go to Norway and understand the ecosystem, this is a good place to be and such. And we also then, of course, have these network groups, which the members organize themselves in various topics. And then, of course, last but not least, we are very active to promote our members and tell stories about our members. So we have a very good website. We use follower on LinkedIn. We have monthly newsletters, and we try to write stories about the cluster. So that was what I wanted to tell you about Norway Health Tech before we delve into the financing side. Any questions? Anything you want to ask so far? Does it look similar to your clusters?
Actually, a question for you, Ariel, because a lot of the clusters are not as advanced as your cluster. Obviously, you have developed so much kind of services for the members. So, how was it when you got started? So, where did you start? Like, should you aim for all of that at once, or what are the
No.
important kind of foundations, really?
Yes, I can tell you about my journey. In Norway Health Tech dates back to 2009. So we are an old cluster. So as Marine said, I built up a cluster called Norwegian Smart Care Cluster, and we started in 2014. So that's 12 years ago. And when we started, it was me and a person on 30% on communication. So this takes time to build up. So of course now we are a mature cluster. We are a very professional cluster. We have been there for a long time. So I had 1.3 headcount. We now have, I don't know, 12, 14 headcounts. So the financial base have been developed over time to do this. And I think it's very important to be realistic and also that it takes time. And the way the Norwegian cluster program was funded when we got in there first time around, now I'm delving into finance, but is that it was in steps. And I felt that it was in year 4 that we had managed to establish a good trust base between our members. Since we are public and private, there was a lot of distrust. The public were not used to the public health side were not used to dealing with companies directly. So that was a big cultural shock that they suddenly need to talk to vendors and understand a different kind of language. So we spent a lot of time working on cultural, so creating meeting places to show that we want the same thing, whether we are a company who delivered technology into this and you as a service provider. So it takes time to build this, and that is not to be taken lightly, because once you have come to this place where you have established trust, there is a lot of things you can do in terms of project wise and things you can take on, because then people trust each other, that we all want the same thing. We want to create a better life for me as a patient and better healthcare services. So I thought to illustrate, I mean, financing is difficult. That is just have to say. So I thought I'd start by breaking up our budget, and there is no secrets. We are a public, but our budget for 26 is 26 million Norwegian crowns. And then you have to take whether you're EU or whatever currency you're using to find out what that is in your numbers. But of the 26 million, approximately 11.6, 45% of this comes from private sources. And the private sources are membership fees, it is services, and it's projects with private funding as part of that. And then the rest, the majority, 55%, is project funding from a variety of public, I should have written public national sources and EU sources into this. So that's the makeup sort of our budget today. And if I delve into the details on the public sources of financing, we have a cluster program. The challenge with that cluster program is that you only get money for 10 years into it. And the funding is part those 10 years, part operations, and now part pass through to companies, meaning that they get reimbursed for services into this. So we have not been part of that program since 2019 because that was when the 10-year rule, and this is an ESA rule, European rule that is on state, I don't know how you call it, state support and so on. But twice we have gotten a one-time funding in something called a mature cluster program. And in 2026, together with Oslo Cancer Cluster, we have a mature program where they rebate the services we offer to our companies. But that's a one-time offer, and it is not happening next year. So on the other public sources, of course, EU sources. We have a variety of national soft funding programs. Few of them fit the cluster. They are more targeted to our members as such. But then we have regional and local projects, and there is the source of what we get most of our money. It's regional. In Norway, we have 3 layers. We have the state with the government. We have something called a county, and a county is a group of municipalities, which is the lowest level. So on a county level, that's what I call regional. We have support from several counties in Norway that pay us, amongst other things, to do the Nordic market entry program. And then we have other programs. But these are projects where we have to apply to get money and with their own reporting into this. So that is sort of the gist of the public funding that we have in Norway, at least. And it's hard. It's very competitive, and it's difficult. We compete on the regional side. We compete with all sorts of initiatives, not just health. It's everything, and the money is getting tighter and tighter. So we are looking on how can we tilt the percentage of 45 private and 55 public to much more private capital, which is, I'm not saying it's easier, but we also need to see how we can get more on that. So on the private capital side, our main source is our membership fee. And this is just our model. We have a model on how we charge the companies, how we charge the municipalities, and how we charge the other type of institutions in Norway. So this is the best funding because that is sort of free funding as such, where we don't have to report. It's the activities we do, and if we get members to sign up, then we do a good job. Then we also have a partner model on some projects. One example, we have a project called Health2Be, which is a public-private physical meeting place in Oslo, in our headquarters in Norway Health Tech, where we have a joint project where we own 1/3, and the other 2/3 is the Oslo University Hospital and the Oslo Science Park. And in that, we have 9 private vendors, and they all pay 250,000 NOK each to be part of that project. So that's membership fee in the cluster, and then on a project base, we are also playing with different models and see can this run. So this is a second type of funding, and you see here the membership fee in the cluster is 40,000 for the biggest companies. Here the ticket is 250,000. So it's larger companies who can do this and get into this. And then, of course, we have over time and over years built a service package. We sell services, mostly around testing. So we have functional testing and usability evaluation. We have product market fit. We have some services around regulatory advisory, and we have what we call white paper or cost benefit type analysis that we sell to our members and others as a consulting fee. And then we build conferences. We have our own conference here, the Health Tech Festival, which we have a complete control ourselves, and that also now generates in the range of 500,000 to 600,000 Norwegian kroner a year. So we are starting to get a good turnover on that one. And we also have another conference that we do with a Norwegian association called Tekna, where we also have financial interest in that it works well. So that's also sources of revenue. But this is continuously work in progress. How can we make good sources of revenue for the cluster? And I wish I had a very good menu for you to say, just do that and that. This is hard work and not easy work. And so that is roughly the sources that we work on: public, private, projects, and then services, a mix of everything, how we balance this.